Welcome to my video series, Patho for Nurses. I'm Professor Scott Krueger, and in today's subject, we're going to be going over some mechanisms of action for our respiratory system. We'll go over a few respiratory disorders to kind of give you a good basis for all of your future nursing classes so that you can be successful and become that great nurse. So a few of the things of the respiratory center that we want to consider is our mechanism of action with inspiration and expiration. Inspiration occurs when the diaphragm and the external intercostal muscles contract. Expiration occurs when the diaphragm and the intercostal muscles relax. The contraction or relaxation of muscles around the lungs change the entire volume of air inside our lungs, and that changes the pressure. So it's important to understand that air is able to flow from areas of higher pressure to lower pressure. When you expand your lungs out, that allows you to exchange gases at the alveoli level. We want oxygen coming in, and we want CO2 coming out. The purpose of having oxygen go into our lungs and mix with our blood is so that we can provide our cells with that spark for metabolism to happen. And what happens after your cells metabolize, make energy, or do whatever they have to do, multiply, mitose, there tends to be an end product of it, a waste product, and that is CO2. So CO2 is formed inside the cell. We want that to come out of the cell, go back into our blood vessels, into our lungs, so that we can exhale that. Many of these respiratory disorders manifest because either there's some kind of inflammation in our airways, there's some kind of congestion in our lungs, the structures of our lungs, the bronchus, the bronchioles, possibly our alveoli are collapsed, or there's mucus clogging our alveoli. There can be clots that can travel from our legs, travel to our lungs, get lodged in some of the structures in our lungs, and then really cause some destruction or complications. Some of the respiratory terms that I want you to understand to get a good basis for all of your future nursing classes include surfactant. And surfactant is a mixture of phospholipids and 4 surfactant proteins. Lung surfactant lowers the surface tension and thereby prevents your alveoli, which are your tiny little sacs inside your lungs that allow for gas exchange. We want to prevent them from collapsing during exhalation. Another important key term here to understand, hypoxia. Hypoxia is different from hypoxemia in that hypoxia, hypo meaning low oxygen supply to the cells. So hypoxia directly is in correlation to the oxygen content inside your cells. Hypoxemia, emia meaning blood, hypo low, inadequate oxygen in the blood. That's hypoxemia. Very easy to confuse those two, but hopefully if you can remember your root words, your prefixes, your suffixes, you'll be able to distinguish hypoxia from hypoxemia. Hemoptysis is blood-tinged frothy sputum. Eupnea, that is just a normal rate of breathing. Cyanosis is that bluish coloring to the skin resulting from large amounts of unoxygenated hemoglobin in the blood. Tachypnea, tachy meaning fast, pnea meaning respiration. That tachypnea is that rapid superficial breathing. Bradypnea, brady meaning slow respiratory rate. Respirations tend to usually be deeper than usual, and they're really slow. Apnea, a meaning without, is cessation of breathing. Some common respiratory disorders I want to touch on today include atelectasis. And atelectasis is basically the collapsing of your alveoli. Once again, those alveoli, very important, they're those small grape-like structures. There's millions of them throughout your lungs. If they collapse, that can really interfere with oxygen coming in and CO2 going out. So atelectasis, complete or partial collapse of a lung section or lobe. Anesthesia's effect on the lung causes almost anyone who undergoes surgery to have some form of atelectasis. Inhaled objects, asthma, and other lung diseases or injuries can also cause atelectasis. There may be no obvious symptoms of atelectasis at first. However, when symptoms occur, they can include trouble breathing, coughing, possible low-grade fever. Treatments for atelectasis include breathing exercises, using qigong, belly breathing, using your incentive spirometer, the little tube, you put it in your mouth, you suck in. Coughing and deep breathing can help with that. Medications, and in rare instances, severe cases, surgery may be an option. Another respiratory disorder I want to touch on focuses on a PE, a pulmonary embolism, and that's a condition in which one or more arteries in the lungs become blocked by a blood clot. That blood clot may stem from somewhere in the body. Typically, it's from the deep veins inside your legs, but it can come from anywhere. Sometimes the heart throws a clot. Symptoms include shortness of breath, chest pain, also known as angina, and cough. Prompt treatment to break up the clot greatly reduces the risk of death. This can be done with blood thinners, drugs, low molecular weight heparins, or certain procedures. Compression stockings and physical activity like ambulation can help prevent clots from forming in the first place. And if somebody is noted to have a clot in their calf or their leg, you never want to massage that area because you could possibly dislodge that clot. Another respiratory disorder I want to speak to today revolves around emphysema, and that is one of the diseases that compromises COPD, chronic obstructive pulmonary disease. It develops over time and involves the gradual damage of lung tissue, specifically the destruction of the tiny sacs in your lungs, the alveoli, where gas exchange occurs. Emphysema is one of the most preventable respiratory illnesses because it is so strongly linked to smoking. Symptoms include shortness of breath, coughing with mucus, barrel chest, where the diameter is the same both ways, so it looks like the chest is coming more out this way, is due to that hyperinflation of the lung tissue. Wheezing and chest tightness is also a symptom of emphysema. Treatment includes bronchodilators, which can help relieve coughing, shortness of breath, and breathing problems because it relaxes our constricted airways. Inhaled corticosteroid drugs and aerosol sprays can help reduce inflammation and may help relieve shortness of breath. If there is a bacterial infection present, antibiotics may need to be prescribed. And anyone who has any type of lung disorder, they're much more at risk of getting a lung infection. The last thing I want to talk about today revolves around treatment of upper respiratory infections like laryngitis. Antibiotics are used to treat bacterial infections only, as they're not effective against viral infections. You'd have to use an antiviral if the virus is, or if the infection is of viral origin. Cough suppressants are useful in treating the cough associated with upper respiratory infections. Antihistamines can be used to treat the sneezing and watery eyes seen in an upper respiratory infections. And lastly, decongestants are useful to treat nasal congestion resulting from the copious drainage that is associated with an upper respiratory infection. Okay, I hope this beginner patho video for nurses was helpful for you. I'm Scott Krueger. We'll hope to see you again